Welcome to Bupa's online masterclass for parents trying to navigate the first 1,000 days. Today we are talking your little one's foray into the world, their grand entrance. It's the main event. If you can't tell, I'm about 2 weeks away from being a new mum myself, and just in case I go into early labour and need someone to hold my hand, we've got a few experts here, obstetrician and gynaecologist Dr. Minky Burke, as well as Chantel, aka Fat Mum Slim, and Beth, who you guys might know as Baby Mac. Welcome ladies. Minky, there's a couple of ways that babies can join us in the world. Can you talk us through what those are and how popular they are?
Okay, so most women will probably choose for a vaginal birth if they can. So that's one option, vaginal delivery versus cesarean section. Now you can get into labour naturally. So when women have a labour or go through labour, they may still need a cesarean section. That is then an emergency Caesar. Or women have a scheduled Caesar. Women who have a vaginal birth can go through labour and have an unassisted delivery, so that means that they push their baby out themselves without any assistance, or they may need assistance, and that may be a ventouse, which is the suction cup, or the forceps. Women may choose to have their baby and their pregnancy care in a public hospital, and women may choose to have their baby privately at home with a private midwife or with a private obstetrician in a private hospital or in a public hospital.
And one's no better than the other, so I guess it's just finding what works best for you. Chantel, you've had a couple of different birth experiences. Talk us through that.
So I've got two girls, one who's 9 and one who's 3. And with my first birth, I kind of went in a bit scared because obviously it was my first child and I didn't really know what to expect. And so I opted for an epidural and they turned it all the way up, so I couldn't really feel anything. I had a nap and got to the end, and even at the pushing stage, it went for 3 hours and I couldn't feel what my body was doing. And she was in quite a bit of stress with that delivery. And then when I had my other daughter who's 3, I opted to have no drugs, and it was a really quick labour, so just an hour. And I could actually feel what my body was doing, so that pushing stage and the whole labour was really different to that first one. So different births, but I think I learnt from the first one what I wanted and how I wanted to go about giving birth as much as I could control the situation.
Minky, there's thousands and thousands of babies born every day all over the world, but things do go wrong. Can you talk us through what some of those complications are?
Yeah, well, I mean, there's always a particular idea as to how you think your labour might go, and yes, things can go wrong or different than what we were hoping for. So your baby can get distressed, what you were saying as well. So sometimes babies do not tolerate the contractions very well, and then they get distressed. So that may mean that women need a cesarean section, or that may mean, depending on where you are in your labour, that you might need an assisted delivery, the ventouse or the forceps. Sometimes, despite trying and having strong contractions and maybe having the medication to make the contractions stronger, babies just don't come through the birth canal, or your cervix might not be opening up completely. And that may also mean that then, plan B or the cesarean section may be necessary. So all those things can happen, and it's not always predictable. So in a way, it is very important, I think, that you do in your mind have those scenarios like, okay, this is my kind of idea, this is what I'm hoping for, but things can go differently. As long as mum and baby are safe, I think we're doing really well.
And then there's also sort of tearing or an episiotomy if you were going vaginally and they needed just a little bit more room to get out, but that's something that you can recover from. Yeah,
so that's definitely another complication or a way to assist the birth. So sometimes women get stuck right at the end, and you do not need to have an assisted delivery because baby's head's just right there, but it's not coming any further. So then women may need an episiotomy. It is also sometimes needed when the baby gets distressed right at the end, and you can get away with not doing a ventouse, but an episiotomy will allow the baby to be born a little bit quicker.
It sounds really scary on paper, but in reality, it's like everything else is going on, so it's actually fine. And the stitches and all the recovery was fine. Everything bounces back. The body is amazing. So
people scared me with those stories the most, and I was like, actually, that wasn't something to be so scared of. I think. It doesn't need to be that scary.
It's true, because the fear of tearing really inhibits women when they need to push, and they shouldn't feel like that, because that area is just meant to heal really well, and it does. So it comes back together just fine, and they shouldn't be scared of that, because it's, in a way, it's part of having a baby. In some women, it's not common, but it can go all the way down to the back passage, so that's a 3rd-degree tear, and that's a significant tear that needs a repair in theory. Don't want to scare you, but that's possible. But the aim is
Across my legs.
the aim is to identify it and get repaired appropriately, so women don't have any ongoing problems.
Beth, we're really influenced by these birth stories that we hear and other people's attitude to birth. Is that something that you experienced?
Definitely. I think, even with my own mum, she would be telling me from teenage years, like, your birth, you turned it the wrong way. I was 3 weeks overdue. I gave her like 40 stitches. She had to be under a ray lamp. Like, I know the story. I know all the things I did wrong. But, people want to just share the war stories and all the things that go wrong. And I was in labour for 3 days. Like, no one's sharing their really positive stories. And I think people don't talk about, like you were saying, that your body knows what to do. Like, trust your body, listen to your instinct, all of those things. So I definitely think what we hear in society shapes our views of birth, and that it's a daunting, scary thing, not that it's the most natural thing that your body knows what to do. I wish I had listened to my body.
Yeah, I think we're terrified of pain. Yeah. So, but it's one of the things that we can control. Can you talk us through, Minky, what pain relief can look like?
Yeah, so I think in a way it is important that women know that everything is available. It's very different from woman to woman what they would like to undergo when they're having their baby. So you can have no pain relief at all. Only very few women do that. Depending on where you are in your labour and when you come into the hospital and how things are going, so the options are there to have some morphine or morphine-type medication. It's usually an injection, and that's very useful for women who want to sleep through potentially some mild contractions, and that can be given every few hours if needed. If things heat up or they don't like the morphine, or it might actually be a little bit later in the labour, then they might try some gas. So gas is very effective, it works very quickly, and it's also out of your body very quickly. It's a bit of hit and miss if women like it. Some women don't like it at all, other women think it's great, but it's definitely worth trying. And of course there's the epidural. So the epidural is for women who may have tried morphine, may have tried the gas, or maybe haven't had a contraction and say, I'm having an epidural, thanks. So it's all there, and I think it's nice to have the choice.
What about breathing techniques? Because you must have utilised those in your non-drug births. Did you employ sort of breathing techniques and did you have candles, crystals? Tell me all the tricks.
I thought I wanted candles and music, and then I got there and I was like, I didn't want any of that. But breathing for me was so important, and I thought I'd learnt at the hospital how to breathe, but the day before I went into labour, I went and had some acupuncture, and that lady was actually a midwife as well, so she taught me how to breathe, and that was amazing to know that the breathing had to come so deep to control those contractions. It was priceless for me in that first labour with that, or both labours actually. I really used that breathing technique really well.
Yeah, I'm not a very good student, so I was like, yep, I'll do the breathing, and I didn't pay attention to it. And the thing that amazes me when you're in labour is you just go into another place. You don't become yourself. You just like go into this other world. So like Chantel was saying, I'm going to have the candles and the playlist. Like, I didn't talk to my husband. I didn't want, you just go into yourself, and you go, particularly my delivery where I had no pain relief, I was just like, I couldn't tell you what I did. I couldn't, other than I pooed and then gave birth. You know what I mean? Like, they're the things that I was aware of, but the rest of it, yeah.
Well, actually, because I've got children myself, and I actually realised that since my third one, for my first I was really underprepared. I went into the labour suite saying to the midwife, I'm from Holland, I'd like to do this naturally, thanks, no pain relief for me. And I ended up with the morphine, the gas, the epidural, and I felt if they offer me a general anesthetic, I'll have it, because it just went on for so long and I felt really out of control. At the end of it, everything was fine. But yeah, so it is there, and it is, it's not always easy.
Can we just talk quickly through the stages and signs of labour? Because in my mind, it's like a movie. You're standing at the sink and then all of a sudden the floodgates open. How does it actually go down?
Well, so you've got this, what they call first stage of labour, and it has got 2 phases to it. The first phase is more like a priming and softening, and getting the cervix is getting ready to actually open up further. And that phase can be very long, so there is no clock on that. So you can be at home and it can be a matter of a week for that to kind of, a little bit of contractions and things ease out again. When your cervix is opened up a little bit further, we usually say around 4 centimeters, that's when that faster stage of labor kicks in. And that's when the contractions are stronger, more regular, and that's when you feel them quite significantly. Then just before the stage that you can get to push, and that's when you're fully dilated, that's the transition, and that's when women lose the plot. And women say, they'll shout out for help, and they just don't know what to do. They get really restless, and that's when midwives and doctors go like, we're going to open up the pack, we're going to have a baby soon. Yeah. So the second stage of labor is when women can push. So you're fully dilated, the baby's moved down, and that's when you're pushing your baby out. When your baby's born, you have the third stage of labor, and that's when the delivery of the placenta. When the placenta is delivered, we always laugh and think now the 4th stage of labor starts, and that's when you have to look after your baby and take your baby home. And that's probably the hardest.
So when do you know that it's time to call the hospital? Do you ladies remember?
Well, when you have the show, which is the mucus plug has... It sounds disgusting, but usually that's when you'll call and say this is happening, and the midwives will let you know. Depends what it looks like, if there's blood or anything like that, or if your waters break. I went in with my second one when my waters broke, and they sent me back home for a couple of days. So it wasn't actually labour, it was just my waters had broken, and not all the waters had come. So it really depends, but that mucus plug is usually the first sign of things are starting to happen.
Yeah, I think you can, like you, Hollywood versions and then the reality. Like I kept waiting for my waters to break, and with all 3 girls, I was induced. So like there was no dramatic gush or anything, much to my disappointment. But yeah, you definitely know, like when you think you're in labour and you're like, oh God, I'm in it, and then you're like, the midwives look at you like, you're not in labour. And then when you're in labour, by word, you know you're in labour. Yeah.
And the thing is, you don't know, like particularly for first-time mums, they don't know if they should ring or stay at home or come into the hospital. So we always say, if you're in doubt, you're not sure what happened, just ring the delivery suite. Yeah. And a midwife will talk to you, she will ask you some questions, and it's either come in or stay at home and give us a call back. So always ring. I think that's
so reassuring, knowing like just that someone's on the end of the line and just speaking to another person. This is what happened, and you're like wanting to discuss the gory stuff, like the plug, and you know that's
they want to know too. They're like, what does it look like? Tell us more. And it's like,
they want to know.
And when your waters break, put your pad in so that we can look at it. And you're like, that's where all the dignity is just like gone, because this is game day. It's not about looking pretty anymore.
And it's a 24-hour thing. So if something happens in the middle of the night, it is 3 o'clock in the morning. Don't feel like you have to wait until 7 or 8 o'clock. If you're concerned or you're not quite sure, the labour ward is 24 hours, so you always ring.
Hopefully at some point before this stage, we've packed our bag. So hopefully partner, maybe, you're going to need to go.
Depending on what they've said to you that day.
Exactly, they may be banished by that point. What else do we need to have in our bag? Champagne?
Yes, definitely.
I wasn't a big packer. I just wanted to take the bare essentials. So it was anything that I'd taken to all the other appointments before, leading up to that birthing experience. And big black undies is what...
Yeah, that is my key. Yeah. I think that is the only thing. If anything else you need, like don't get your nice patterned pyjamas that are like white, because you're going to be bleeding like a stuffed animal and it comes out. So you need like the bigger pads you can get, the better. Like Nana undies, go big.
Yeah, bigger than what you are.
And like just lots of black things, and like hoodies, like tops that you can breastfeed easily, because you'll be doing a lot of feeding in the hospital, and boobs out and lactation consultants and people prodding and stuff. So I think clothes that you can easy access, like just like nothing that you'll ever want to wear again.
And snacks for your husband too, because could be a long labour. And then the one thing that I was surprised by is nappies, because depending on what level of care you have at a public hospital, they might provide nappies for the first day, and then you'll need to bring your own for the other days that you're there. So it depends what care you have, but I'd talk to a midwife during your antenatal care.
Once Bub's arrived, what should we expect? I'm sure there's tests, they're probably taking them off to weigh them and do different things. What does that little bit of window of time look like after Bub's arrived?
Oh, so it's one of the most beautiful times, and it's a time when you actually see your baby and get to know your baby.
Yeah, same. When you think about it.
And that's really for mum and dad, or for support person, or for partners, you know, to have that moment together. And that should stay like that for a little while. So there's no rush in getting people in to visit. So I would say, you know, for the first couple of hours, few hours, at least have the family together. The baby can stay on mum. It doesn't need to be weighed and checked straight away. If the baby's fine, mum is the place to be. Of course, if there's any concern about how the baby's, you know, born, or if it needs any kind of bit of stimulation, then yes, the baby will be checked on the resuscitator. But weighing and all of those checks, that can wait a little bit. So that's usually done within the first couple of hours of birth. And when the baby's on mum's chest, it will develop the reflexes of wanting to feed. So that's quite beautiful as well. So that moment should stay with them, I think. And then later on, they can do whatever they want to do. But it's very nice to stay together.
Okay, fact or fiction, do I need a 48-page birth plan?
I think it was nice to have a birth plan. It really helped me figure out what I wanted from my birthing experience, and I went public, so part of my program was to write a birth plan for both my births, and the midwives have that. It doesn't mean that it's going to go to schedule and that's exactly what's going to happen, but they can look at it and go, this is what she wants, or is hopefully aiming for. And it was nice, you know, anything can happen, but at least I knew kind of what I was hoping for an outcome.
Yeah, I guess it gives you a bit of a sort of map of what you would like to do, but I think you could kind of burn it alongside your smudge sticks over in the corner with the natural birth that's going on, because anything can happen and your best laid intentions can go not to plan, and you can get disappointed if things don't go to plan. So, you know, don't think it's going to be like this, because then you'll beat yourself up, and like, you don't need to be beating yourself up at the start, because you've got so many more things just ahead of you that you can beat yourself up about.
Yeah, I totally agree. I think nothing in life really goes according to plan. That can lead to disappointment. So I do think it's good to be open-minded, but have a bit of an idea what you would like.
Plan is healthy baby.
That's right,
Exactly.
healthy baby and healthy mum.